Greetings. A few weeks ago, guy came and he decided to ask a question on the very first video I did on this channel, which is titled, "What is a Charge Master?" So he asked his question and I answered his question. Then he asked a follow-up question and he had a few things in there and I answered those questions. Then he basically posted a rant, and it was a long rant and it was a whole bunch of different things. And at that point, I wrote back and said, okay, I now understand you don't really want to ask any questions. You don't really want to know what I have to say. You basically just want to rant. I'm not here for that. I don't have time for that. So you're just going to be talking to yourself. And I left the conversation. That didn't stop him. He decided to leave a couple more long responses. And at that point, I said, you know what? I just got to block him because I didn't want to deal with that. It's okay if someone disagrees one time, but if you respond and you respond nicely, then, you know, that should pretty much be it. Because I truly sympathize with all the patients who have to go to medical entities. It's not just hospitals. It's nursing homes. It's some physician services. I mean, you know, from the patient side, I've had to deal with that. Sure, I know that there's a lot of physicians' offices that upcode things. They don't like being told that by anyone, but they do that. I know that the nursing homes are totally messed up because I basically had to go after a nursing home who tried to charge my mother, who had passed away, this exorbitant amount. And of course, I knew what the billing rules were, and so I was able to beat them at that. I didn't sue them, but I did threaten it. But I had talked to the state, I had talked to the county, I had talked to Medicare. I already knew what the rules were, so they knew, okay, we need to leave this guy alone. They said they were going to send it to the corporate offices, which I didn't even know they were a corporation, but I understand how this works. Now, here's the thing, except for nursing homes, because in essence, they're kind of a for-profit organization, especially when they're part of an organization. Nobody else is trying to do a scam. What the problem happens to be, and I'm going to talk about hospitals for the moment because hospitals really what I want to talk about. You're not being scammed. What's going on is that there's a lack of true education on how to price charges, how to select the right charges, and on the back end, how to follow up with patients' questions properly so that you can offer satisfaction to them when they have an issue with a bill that they received. And I know why it happens. And I'm going to just mention that because, like I said, it's not a scam. Here's the thing. A scam is basically an intentional act that someone is trying to do to take money from you, and they know what they're trying to do. And there you go. Well, in a lot of hospitals, okay, overwhelmingly, most hospitals don't have this process down correctly. Because in most hospitals, the overwhelming majority of the people working there have never heard the term charge master. And those who have never seen a charge master, have never seen how it's set up, have never seen how it's priced, how it's coded, the descriptions. They've never seen any of that. And in most of those hospitals, they don't have a person or a department whose job it is to look at the charge master and make these determinations. There's some, you know, some of the major hospital systems might have a department that looks over all those, because I consulted at one of those down in Tennessee some years ago. So they actually had a department that did that. But the department spent more time basically checking on coding and new charges rather than going back and looking at some of the older ones. And unfortunately, it was a large hospital system, and I brought up a few things here and there, but overall, you know, I only had a little bit of pull because, you know, I was working with people who were going to be there. They were getting a new system in. I was there to help manage the old system until they got the new system in. So, like I said, I understand how this works. And the problem is that when you have people who get new charges in, or new supplies, or new procedures that can be done, they might understand how to code it if they've read all the stuff that goes with these new procedures. Then, at least they can do that part. They come up with their own descriptions of what things are, which is sometimes problematic. Okay, it's mainly problematic. But pricing, they don't understand how they should price things, at least initially. Almost none of them do. So when I consulted at one hospital for a year downstate almost 16 years ago, heck, what am I talking about? It was 17 years ago. That's what I walked into, because the hospital hadn't had anyone looking at a charge master for about 2 years, and they put an accountant there who had no clue what to do, didn't know the job, but the people who put him there didn't know the job either. So that's problematic. You have the CFOs, the folks who are kind of responsible for budgeting and trying to help set rules for how to charge things, who don't understand how it works, because overwhelmingly a lot of chief financial officers don't really have a true healthcare background. A lot of them are auditors. Some come from industries that aren't healthcare, where accounting is totally different. And when you come from retail, you have an idea of how things are supposed to be marked up differently, because I worked a little retail before I got into healthcare. And, you just mark stuff up based on how it kind of comes in, and that's your price. And there it is. You don't write anything off. Someone comes in and they want to buy a can of soda. There's the price right there. They pay for it. But it doesn't work like that, because in hospitals, you don't get paid for what you charge by almost anybody, except some self-pay people. And in some states, that's been rectified at least a little bit. And what we call straight up commercial insurances. In other words, insurances that you don't have a contract with. And even then, they may not pay the entire thing. They may send the balance to the patient to have to pay. Or in some instances, they may contact the facility and see if they can make an arrangement where they can have some kind of discount, maybe 10 or 15%. Some hospitals will go for that. Some won't. When I was doing that job, along with a lot of other stuff, I okayed those. I had no problem. Now, if they wanted a 50% discount, I wasn't giving them that. So, we have our rules. We're okay. I had the rules, because nobody else in the facility would have been able to answer that question. So I just took the lead on that, and that's what I did. So it's not a scam, but it's not understanding how the process works. For instance, one of the things that a lot of people like to talk about is an aspirin. They had an aspirin on a bill and they got charged $80 for it. Yes, that's ridiculous. 1. 2, it's supposedly illegal to bill for that because it's an over-the-counter drug. So you're not supposed to bill for that at all. And that is where the folks who do the ordering for those supplies or those pharmaceuticals, because it's actually 2 different departments. If it's an aspirin, it comes through the pharmacy, but if it's other supplies, it goes through purchasing. Don't understand that when you order something in bulk, you don't charge the bulk price for every single item. You could only charge for each individual item. So if you get a bottle of aspirin and there's 100 aspirins in there, you don't charge $80 per each one of those. You prorate it. And if you prorate it, well, the aspirin's going to come to 1 cent. You don't bill anything that's that low anyway, but you're also not supposed to bill over the charge. But how many people actually know that? Not as many as you would hope. But it's not a scam. What it is a lack of education, a lack of training, and a lack of who do you go to learn those things. That's just how that is. That's why, and this is not really a sales pitch, but it is a sales pitch. That's why I have created a training site. It's called Healthcare Revenue Cycle Training. Because my hope is to help educate at least enough people across the country who either are already working in hospitals, who would like to learn more about the job that they should be doing, or help to convince hospital administration that, hey, you know what, we need to probably hire somebody who can handle all these specific different areas, because we really don't have anyone who knows how to do it. Sometimes they think they do, but you know, today is actually the 21st anniversary of my being self-employed. I've been to a lot of hospitals across the country. I've talked to a lot of people in different departments, in billing, well, okay, we'll just say in billing. And it's been scary, the things that I've seen and the things that I have learned that people don't know. So, you know what? I take my shot at it and do what I can. Now, if you're in healthcare, I've put the link down below if you want to check out the site, because I've got 4 free articles on there that folks can look at, and it's educational. So there's that. But I just wanted to say that for everybody else. Are they scammers? No. Maybe a bit of incompetence? Yeah. But like I said, that's not just hospitals. So there you go. My name's Mitch Mitchell. Y'all let me know what you think. I hope you have a good day.